What are the causes of prostate benign hypertrophy? One is age related, second is genetic disorders, third is because of some drugs, and fourth, it can be because of certain endocrine disorders which leads to enlargement of the prostate. Hello friends, myself Dr. Priyank Salecha, Consultant Urologist and Andrologist at Apollo Spectra Hospital, Hyderabad. So now we will be talking about benign prostate hypertrophy in men. So what is prostate gland? Prostate is a walnut gland which is present beneath the bladder encasing the urethra. This gland is very important in processing the semen in the younger age. After the age of 45, under the effect of some hormones, this prostate gland starts enlarging, as a result of which it leads to compression of the urethra, the pipe through which the urine comes out, which leads to a condition called benign prostate hypertrophy. What are the causes of prostate benign hypertrophy? One is age related, second is genetic disorders, third is because of some drugs, and fourth, it can be because of certain endocrine disorders which leads to enlargement of the prostate, which in turn leads to narrowing of the urethra. So what are the symptoms because of benign prostate hypertrophy? It mainly affects the men of age group more than 55 years. It mainly consists of two types of symptoms: obstructive symptom and storage symptoms. They need to put some pressure during urination. They feel as if the urine is not completing evacuating. What are the storage symptoms? Like there will be more frequency, there will be more urgency, and there will be hesitancy. So these are the symptoms which are leading to BPH, and whenever you find these symptoms, please contact to the nearby urologist. And how BPH is investigated? When you go to a doctor, he will investigate you mainly in three forms. One is they will do a sonography to know the size of the prostate, to know how much urine is staying back after evacuation. They will do a blood report which mainly consists of serum, prostate specific antigen, and they will do a flowmetry report called uroflowmetry. Depending upon this, they will brief you whether you are a candidate where you should go for a medical management or whether you go for a surgical management. So now the question arises, when you need to go for medical management and when you need to go for surgical management. So medical management is mainly advised for those men whose uroflowmetry is beyond 12 ml per second, and when the quality of life is much more maintained, as a result of which they can and they will, and their symptoms can also be decreased with the help of medical management like alpha blockers and also by aromatase inhibitors or a combination of both of them. But suppose if the patient with BPH starts developing renal function failure, like the creatinine is increasing on ultrasound, when there is swelling in the kidney, or they are having blood in the urine or stone within the bladder, these are the factors where you should be alert and you should go to a nearby doctor, and surgery is advised. Surgery in nowadays is more advanced, is mostly endoscopic. We do it with lasers. The recent advances in prostate surgery is urolift, which is a daycare procedure, and as a result of which it can be done on patients who are on antiplatelets, who are cardiac patients. These are risk-free procedures where a urolift staplers can be done. The upcoming techniques which we are going to do in Apollo are resume, which is definitely an upcoming procedure, an advanced procedure which will benefit a lot of old age patients. Obstructive symptoms and storage symptoms. So obstructive symptoms means they have problem initiating the urine. So if you have any such problems or queries, please reach out us at Apollo Spectra Hospital, Kondapur, Hyderabad. We'll be happy to serve you. Thank you.